everybody. Today we're going to talk about what are the benefits of psychological testing for your child. I'm Dr. Leslie Blevins, and you can visit me at enildaclinic.com to learn more about my psychological services for children and parent support services. Okay, so let's get started. So there are different types of psychological testing. One is just your basic psychological testing. That's whenever we're talking about anxiety, depression, separation anxiety, social anxiety, behavior disorders, things like that. And then you have neuropsychological testing. That happens a lot more frequently for children. Those are things whenever we're starting to look at IQ, we're starting to look at social skills, things for autism, language disorders, those types of difficulties. And then we have psychoeducational testing, and those are whenever we're starting to look at learning disabilities, the types of difficulties that are going to happen more commonly in the classroom. ADHD testing, that actually happens with neuropsychological testing. So I do all of these, and I start from 2 years old, so we can actually go all the way down that young with our testing skills. And we're looking at the differences that a kid might have with their same age peers compared to their same age peers. And so by seeing all those differences, we can start to see if a kid is having true difficulties that need intervention supports. And my testing goes from 2 years old all the way up through 22 years old. So let's dive into it. So why would you want to even look at getting some sort of psychological testing for your kid? One of the big reasons is to figure out what's really going on. A lot of times what I see whenever a parent first comes in and they're thinking about testing is there are some assumptions about why a kid is really doing something. And so a lot of times those assumptions, some of the assumptions might be kind of aimed at the kid's character. Oh, they're not motivated, or they just want to, or they just don't want to do what they're told. And that can feel really bad for the child, but it also feels really bad for the parent too. Sometimes the parent's coming in and they're feeling pretty defeated. And then you also have the dynamic between the family and the schools. And so the teacher might also feel pretty defeated. And that doesn't feel good whenever everybody's interacting with each other on a day-to-day basis, or with the emails home or the phone calls home. And so a big reason to kind of get down to it with psychological testing is to find out what the actual difficulties are. And I can tell everybody listening to this video that I have never diagnosed a kid as a bad kid. I've never said, oh, they have poor character. That just doesn't happen. What I do say frequently is that a child is trying to get their needs met, and commonly they develop a learning history over time where they have learned inappropriate ways of getting their needs met. But just like you and me, we're normal, right? We have needs too. I need attention, you need attention, we need sleep, we need food, we need water. There's all kinds of things that we need, and the longer we go without those needs being met, the more and more inappropriate we get. Kids are the same way, except that many times they just don't have the skill set to ask appropriately to get their needs met. And sometimes we put them in, fun little classrooms where they have to follow rules all day. So getting their needs met, if they really have a high need or they have a true deficit that makes them have more needs, it makes it even harder for them. And so psychological testing helps us to understand what those needs are and what their capacity is to tell us, adults, what their needs are, so that I can, as the psychologist, I can tell you parents, and then I can also tell the teachers, what is this child's ability level in several different areas like language or impulse control, reading skills, the kinds of things that everybody can then work with and actually support the child. And then we start to diminish some of the problem behaviors that might be the actual reason that you brought your child in for testing to begin with. So then what this tends to do, once you really know what's going on, let's say that your kid is acting up during school and we start to learn, it really only happens whenever there's a reading assignment. We figure out, oh, it's a reading disability or dyslexia. What really then happens is that you have a name for it. You start to understand, wow, this isn't something that's being intentional, and your child starts to understand, oh, I'm not a bad kid, right? something that I see oftentimes whenever the core cause isn't known is that the child identifies as being a bad kid, that they just do bad things. And so their self-concept starts to drop the older they get, whenever nobody knows what's going on. So psychological testing, a big reason for it, is to help maintain a child's sense of self-esteem, because it helps them to understand that, you know, they're a great person, nothing's wrong with them, they just probably think differently in some way, and they just need to develop some interventions and some extra support, some accommodations, so that they can function the way that they would like to. So another big reason for getting an evaluation is to actually get the label. And I know we don't like labeling each other, but let me explain what that label does for you. So in this sense, in this, you know, one sense, this label is a good thing, because what it does on the research side of things is it allows us to identify the kinds of supports that are going to be helpful for your kid. The label itself, you know, it gets money for that research. And then on the more day-to-day side, what you guys are going to see in the family is that that label is actually going to qualify your kid to get supports in the classroom, or they're going to qualify your child to get disability services if they have a low incidence disability like autism, something where they're going to need support across the rest of their life. And so not all the time is a label necessarily a bad thing. Sometimes it's needed so that we can actually gain support and gain understanding from each other. The other big thing that a label actually does for families is that it allows you to start to seek social supports among your community. And so whenever you're Googling something and you don't have the language to be able to reach out to friends or family or to, you know, the World Wide Web in general, it's hard to find people that understand and relate to what you're going through in your house. But whenever you finally do have a word that describes it, you can much more easily reach out, find those supports, and start to not feel so isolated. You start to have other people that get it, and then suddenly you can start to advocate for your child more easily. You can start to identify more interventions and start to move forward and start to just kind of accept and to start to grow and feel more joy. And so that's really important. The third big category of reasons for doing psychological testing is that it opens up the doorway for targeted, effective interventions. What you can imagine is that, you know, up until this point, if we don't really know what the core deficit is that's leading to a child's either misbehaviors or just a lack of adaptive behavior, you might be targeting the wrong thing. And, you know, I was trained as a school psychologist, so I've worked inside the school systems quite a bit. I have ton of training on testing, so I've seen this a lot where you have a child who's showing deficits, typically in behavior, and the intervention is designed to get the child to just behave, just pay attention in class, just sit still in class. And then whenever we do testing, what we see is that the child might have a academic deficit. And so what you can imagine is that, you know, in our day and age here in the US, if we're giving a 2-hour reading block and that child has very little skill in reading, but we're not really giving them support in reading, it's hard to maintain attention. It's hard not to act inappropriately for 2 whole hours every single day. And on top of that, there's a sense of anxiety that might even pop up during that 2-hour reading block. So identifying the core deficit is important to actually targeting and changing what's happening for the child, and then the behavior concerns start to diminish too, and you start to see improvement across the child's whole life. So it's a way to really start seeing some speedy improvement by targeting the real root cause. So you stop reducing wasted time, and you start to reduce your frustration. And of course, our big goal here is to also really to improve the meaningful life outcomes for children and for their families. So that's the video for today. Again, if you'd like to learn more about psychology and child therapy and also parent supports, you can visit me at enildaclinic.com. And then just a quick disclaimer, this video is for educational purposes. If you have specific concerns about your child, you can always reach out to me or you can contact your pediatrician. Thank you.